Welcome to PASRR Level 1 Screening Training. If you're new to PASRR, please review acronyms and additional training materials on our PASRR webpage. Overview. The Level 1 screening is submitted online by the facility and is a tool used to help identify possible serious mental illness, SMI, or intellectual disability, developmental disability, or related conditions, IDDRC. Keep in mind, a positive level 1 doesn't guarantee the need for an evaluation. How to start a new level 1 screening in the PASRR system? First, log into the PASRR system using the direct link portal.dscs.ca.gov. Enter your Microsoft account credentials, then select the PASRR production icon. On the dashboard, select the Level 1 drop-down menu and select New Level 1 Screening. Key tips. Required fields are marked with an asterisk. You can hover over the blue circle to view definitions or additional details. Facility information. This section identifies the facility submitting the Level 1 screening and includes the facility's current contact information. Please ensure the contact information is accurate and up-to-date, as it may be used by the DSCS contractor if a Level 2 review is required. The facility name, facility address, facility phone number, day start, and name of person completing the Level 1 screening will auto-populate based on your PASRR account. If any of this information is incorrect, please stop and contact us via IT Service Desk at dscs.ca.gov for assistance. Also, please provide the following contact information: direct phone number and attentions if applicable. Facility discharge planner fax number. Facility medical records fax number. Direct email address and preferred contact methods. The drop-down menu will display all available contact methods. Please select your preferred option. This information should make it easier for the contractor to get in contact with you to screen the case for a possible need for an evaluation, leading to the case closing faster. Section 1. Individual Information. Questions 1 through 6. This section identifies the individual and specifies the Level 1 screening type. Question 1. Enter the individual's last name, first name, and middle name. Question 2. Enter the individual's date of birth. Question 3. Select the individual's primary language from the drop-down menu. It will auto-populate to English unless you select another language. Question 4. Select the individual medical plan information from the drop-down menu. Options include Medical Client Index Number (CIN), Medicare Beneficiary Identifier (MBI), Private Insurance Number or ID (PIN). The field will default to CIN unless another plan type is selected. You may hover over the blue information icon to view the required format for each plan. After selecting the plan type, enter the corresponding plan number in the text box. Question number 5. Select the screening type: initial pre-admission screening (PASS) or resident review (RR). Choose initial pre-admission screening or PASS for a new admission to the Medicaid Certified Skilled Nursing Facility (SNF), resident review or RR, which is status change. SNFs select this option only for current SNF residents, readmissions, or inter-facility transfers who experience a significant change in condition, or when the allotted days of the previous PASRR has expired and the screening must be updated. Question 6. Enter the individual current admission date to your facility. For community admission to the SNF, a future admission date may be entered. Level 1 screening duplicate, check and save. After question 6, the system will automatically perform a duplicate check. If your facility has previously submitted a similar screening, a warning pop-up will appear. If the screening is not a duplicate, select Continue to proceed with completing the submission. Keep in mind, this only applies to submitted screenings. In-progress screenings will not be identified as duplicates. If you save the screening after completing this session, the system will assign a 9-digit PASRR CID number, and the case status will update to In Progress. In Progress cases can be edited by selecting the Edit Screening button on the Level 1 case list. The system will retain an In Progress case for 2 weeks. If it is not fully submitted within that time frame, it will be automatically deleted.
Section 2. Intellectual or developmental disability or related conditions, IDDRC. Questions 7 through 10. This section assists in identifying whether an individual has a suspected or confirmed diagnosis of IDDRC. Question 7. Does the individual have or is suspected of having a primary diagnosis of an intellectual disability, developmental disability, or related conditions, IDDRC? IDDRC includes intellectual disability, cerebral palsy, epilepsy, autism, and closely related disabling conditions, but shall not include conditions that are solely physical in nature. If yes, a text box will appear where you can specify the suspected type of IDDRC, confirmed IDDRC diagnosis. And question 8 will be required. If no, question 8 is not required, proceed to question 9. Question 8. Because of their IDDRC, the individual experiences functional limitations. Examples of functional limitations include mobility, self-care, self-direction, learning, understanding, using language, and capacity for living independently. These limitations shall not be related to a physical or mental health condition that the individual is also experiencing. They should be limitations caused solely by a developmental disability or condition. If yes, a text box will appear to describe the functional limitations and proceed to question 9. If no, proceed to question 9. Question 9. Has the individual ever been referred to Regional Center for Services? If yes, a text box will appear to provide the name of each regional center the individual has been referred to and proceed to question 10. If no, proceed to question 10. Question 10. Has the individual received services through a regional center? If yes, a text box will appear to describe the services and proceed to question 11. If no, proceed to question 11. If any questions in this section are answered yes, the case will be positive for IDDDRC and will automatically be referred to the Department of Developmental Services, DDS, for their IDDDRC Level 2 referral process. For questions related to this section, please contact DDS at 833-421-0061 or dds.PASRR@dds.ca.gov. Section 3, Serious Mental Illness, SMI, questions 11 through 15. This section assists in identifying whether an individual has a suspected or diagnosed mental illness, MI, and if the MI qualifies as a serious mental illness, SMI. Select yes or no for the following questions. Question 11, diagnosed mental illness. Does the individual have a diagnosed mental illness disorder, such as depressive disorder, anxiety disorder, panic disorder, schizophrenia, schizoaffective disorder, or symptoms of psychosis, delusions, and/or mood disturbance? If yes, a box will appear to select the type of disorder, and question 12 will not be required. Proceed to question 13. If schizophrenia, schizoaffective disorder is selected, question 13 and 14 will automatically be marked yes for functional limitations and recent treatment, as this condition is automatically considered serious. Whether it's selected, a text box will appear to specify the diagnosis not listed or to describe the symptoms. If no is selected, proceed to question 12. Question 12, suspect mental illness. After observing the individual or reviewing their records, do you believe the individual may be experiencing serious depression or anxiety, unusual or abnormal thoughts, extreme difficulty coping, or significantly unusual behaviors, or does the individual actively engage in community mental health services? If yes, a text box will appear to describe the symptoms or behaviors. If no, for both question 11 and 12, submit the screening. It will close out as negative and a notice of no need letter will be generated. If yes, for either question 11 or 12, proceed to question 13 and 14. Questions 13 and 14 determine whether the suspected or diagnosed mental illness disorder qualifies as a serious mental illness, SMI. Select yes, no, or unknown for the following questions. Question 13, functional limitations due to mental illness. The mental health disorder results in functional limitations in major life activities within the past 6 months. For example, the resident is no longer able to meet work demands, interact with family and friends, or attend medical appointments due to anxiety, depression, or bizarre thought processes, etc. A resident typically has serious difficulty in at least one of the following characteristics on a continuing or intermittent basis. Interpersonal functioning. Interacting appropriately with, communicating effectively with other persons, has a possible history of altercations, evictions, homelessness, fear of strangers, avoidance of interpersonal relationships, and/or social isolation. Concentration, persistence, and pace. Sustaining focused attention for a long enough period to permit the completion of tasks, commonly found in work settings or in work-like structured activities occurring in school or home setting. Difficulties in concentration, inability complete simple tasks within an established time period, makes frequent errors, or requires assistance in the completion of these tasks. Adaptation to change. A resident has serious difficulty in adapting to typical changes in circumstances associated with work, school, family, or social interaction, agitation, exacerbated signs and symptoms associated with the illness, or withdrawal from the situation, or requires intervention by the mental health or judicial system. If yes, no, or unknown, proceed to question 14. Question 14. Recent treatments due to mental illness. The recent treatment history indicates that the resident within the last 2 years has experienced at least one of the following: psychiatric treatment more intensive than outpatient care, for example, hospitalization or other acute intervention. Due to the mental disorder, homelessness or an episode of significant disruption to the normal living situation, requiring supportive services, relocation to a residential treatment environment, or intervention by a housing authority or law enforcement. Suicide attempts. If yes or unknown for question 13 or 14, the screening is on track to become positive for SMI, depending on how the questions are answered in the next sections. Proceed to question 15. If no is selected for both question 13 and 14, question 15 is not required. Submit the screening. It will close out as negative, and a notice of no need letter will be generated. Question 15. Psychotropic medication. Has the individual been prescribed psychotropic medications for serious mental illness? If yes, a text box will appear to specify the psychotropic medications and proceed to question 16. If no, proceed to question 16.
Section 4, Categorical Determination, questions 16 through 19. This section helps identify whether an individual has a categorical condition that will prevent them from benefiting from specialized mental health services. Only one question out of questions 16 through 18 may be answered yes. If you select yes for any one of the questions, the remaining 2 questions are not required. If any question in this section is answered yes, the case may close as a categorical, depending on how the next section is answered. Select yes or no for the following questions. Question 16, brief stay. The individual requires a stay of less than 15 calendar days. If yes, 16A will appear to select the reason for brief stay. Either select providing respite for caregivers for a period not to exceed 14 calendar days, or protective services where the stay is not expected to exceed 6 calendar days, or in an emergency situation requiring protective services with placement in a nursing facility not to exceed 7 calendar days. If one of the reasons apply, questions 17 and 18 are not required. Proceed to question 19. If none of the reasons listed apply, you must select no in response to question 16 and proceed to question 17. Question 17, delirium. The individual has a diagnosis of delirium, and further diagnosis cannot be made until the delirium clears. If yes is selected, questions 16 and 18 are not required. If no is selected, proceed to question 18. Question 18, severe physical condition. The individual could not benefit from specialized add-on services because of conditions including but not limited to coma, ventilator dependence, hospice, and neurocognitive disorder. Neurocognitive disorder and the previously used term dementia refers to a physical condition that disrupts the individual's capacity to engage in productive interaction or to communicate their needs, such that participating in a face-to-face or telehealth evaluation would be unreasonably disruptive to their care. If yes is selected, a text box for 18A will appear to provide the specific severe physical condition that prevents the individual from participating in specialized add-on services, and questions 16 and 17 are not required. Question 19. Please select the data sources that is the basis for the above categorical selection. Select either hospital facility records, physician evaluation, election of hospice status, records of community mental health centers, records of community intellectual disability or developmental disability providers. Section 5, current physical diagnosis, bed type, and exempt hospital discharge. Questions 20 through 22. This section assists in identifying physical health diagnoses, bed type, and if they qualify as an exempt hospital discharge. Enter information in the text box for the following question. Question 20. Specify all the individual's current physical diagnoses that require skilled nursing facility services. This section can also be used to give additional information to the Level 2 evaluation contractor. For example, the name of the SNF the individual is being discharged to, and the planned bed type placement. Question 21. Identify the individual's current location by selecting one of the following: General Acute Care Hospital, Nursing Facility, State Veterans Military Hospital, Acute Psychiatric Hospital Unit, Special Treatment Program, Institution for Mental Disease, Intermediate Care Facility, or other, but please make sure to specify. If the individual is a community or out-of-state admission to the SNF, the SNF should select other and enter the individual's current location information. Select yes, no for the following questions. Question 22. Does the individual meet the criteria for exempt hospital discharge, EHD? The hospital may select yes only if all of the following criteria apply. The individual is directly admitted to the Medicaid Certified Skilled Nursing Facility, SNF, from a hospital after receiving acute inpatient care at the hospital, and the individual requires SNF services for the same condition for which they received care in the hospital, and the attending physician has provided written certification prior to SNF admission stating that the individual's stay is likely to require fewer than 30 days of SNF services. This certification must be provided to the SNF to ensure the EHD was used correctly. The SNF must select no for this question, as SNFs do not meet the qualifications for an EHD. If yes is selected, the Level 1 screening will close out at L1, exempt hospital discharge. An exempted hospital discharge letter will be available on the Level 1 case list. If no is selected, the following closure outcomes may occur. Categorical. If one yes is selected in Section 4, categorical determination, the resolution will be L1, categorical review during Level 2 review. The DHCS contractor will confirm whether the individual meets the categorical condition. If confirmed, the resolution will close as L1 categorical, and a categorical letter will be available on the Level 1 case list. Positive for SMI. If all responses in Section 4, categorical determination, are no, The case will close as positive for SMI, and the status will show L1 submitted during Level 2 review. The DHS contractor will verify the qualifying SMI condition and request medical records before scheduling a Level 2 evaluation. If the Level 2 evaluation contractor determines the individual does not have an SMI, the resolution will close as L2 attempt, no SMI, and an attempt letter will be available on the Level 1 case list. If the contractor confirms the individual does have an SMI, a Level 2 evaluation will be completed. Afterward, the case is forwarded to a DHS consultant psychologist for review. Once finalized, the resolution will be determination available, and the determination letter will be available on the Level 1 case list. Before we finish, I would like to remind for one important reminder. When submitting a Level 1 screening, please always wait for the page to refresh back to the Level 1 case list. If you close the browser too early, the screening will not be fully submitted.
Level 1 screening corrections. There are two categories for correcting Level 1 screenings. The first are in-progress screenings. These can be edited by selecting the pencil icon on the dashboard or Level 1 case list. These will automatically delete from the PASRR system after 2 weeks if not submitted. The second are submitted screenings. These cannot be edited even by DHCS. For minor demographic errors such as misspelling the first or incorrect date of birth, make handwritten corrections on the printed PASRR documents and initial the correction. For major demographic and/or clinical errors such as entering the wrong last name or selecting the wrong option for clinical questions, the hospital must submit a new PASRR as a pre-admission screening, and the SNF must submit a new PASRR as a resident review to update the previous screening. Thank you for attending.